Hello viewers, my name is Oni Gift and you are on to PMTV Nigeria here in Agbor, Delta State. Following the outbreak of the potent coronavirus as at yesterday, 24th March 2020, 46 cases have been recorded so far in Nigeria. The Nigerian government have employed possible measures to safeguard the health of Nigerians, thereby give directives for the closure of schools, religious and social gatherings. Therefore, enjoined everyone to take precautionary measures so as not to get infected by the COVID-19. As you can see, the people, they are not putting on their face masks, they are not wearing hand gloves, they are not using their hand sanitizers. So come with me, let's hear from the people on how they are safeguarding themselves of the coronavirus.
I'm Dr. Adeyemi Oladoku. I'm a medical lab scientist, managing director, chief executive officer of Model Medical Laboratories here in Agbor. Yeah, you know, the first law of nature is self-preservation. That is why you see me like this. But we try to extend this beyond ourselves because you cannot live in isolation. We try to make sure that everyone who enters these premises is protected as far as we can. If you look outside, you will see where you can wash and sanitize yourself before you enter these premises, and we encourage them to do the same thing when they are going. Our staff are protected. Apart from that, internally we have established a rule where every doorknob in these premises must be cleaned every 30 minutes, and the floor must be scrubbed every 30 minutes with disinfectants and what have you to dislodge possible anything. Though we have not seen anyone in Delta State, but prevention is better than cure. If you look at our windscreen outside the television there, you can see that we are permanently tuned to CNN, so that whoever comes in gets current information about what's happening. So we are doing all this to protect people and create awareness. Luckily, a lot of people come in and they appreciate what we are doing. You see them wash their hands without compulsion or whatever, and it's quite heartwarming. This is a private organization. We hear on televisions, we read on the papers. The government has PPE, personal protective equipment. If they can extend the full gear to us, including the face goggle, that will be fine. But on our own level, this is our own PPE now. We protect ourselves with nose mask. We wear our gloves. We put on our laboratory coats and do the necessary hygiene to make sure that we dislodge any form, if at all any. People should know that this thing we are talking about is real. Just now I heard over the television that Prince Charles in the UK has tested positive. It does not discriminate wherever your status, whatever your status. No, everybody should be prepared and be ready to do the right thing at the right time. And this is the time to do the right thing by protecting yourself and making sure that no chance is given for coronavirus to exist where you are. People should learn not to touch anyhow, keep the social distance from each other, avoid global or public gatherings. Even when you go to bank, they say they are bringing them in 2020 or whatever number. But when you look at the queue, it's enough to incubate all of them at the same time. Protect yourself from this thing we are talking about. Stay at home, except you have an essential service to render. All our speculations we are hearing and trials, medical trials, like we are talking of zithromycin combined with chloroquine, it can help. If you have it, even before, you can do what we call prophylaxis with it. You can as well take other precautions by taking warm or hot water in the for your throat to keep moist. You can sanitize yourself, get a personal sanitizer. As you move about, you touch money, you touch anything at all, sanitize your hand and keep yourself neat from contact. Some are just adamant. It's not expensive. How much can you buy someone's life? What's wrong with protecting yourself with 200 every day? The gloves maybe 50 naira. But maybe consciousness for expenditure and all those things. But it's advisable. Wear one every time. I'm happy to see you guys in this form. I see it as a necessary step because we are very religious in this country. You see people gathering the churches in huge number, and so many churches in each street you can see up to 10. And this thing is not limited to only the churches. I heard over the television the chief imam of I think this Nigerian Muslim society. He came on board on news to tell every worshipper last Thursday that please, tomorrow's Jumat service, worship from your house. That's responsible leadership, and that's what is expected of our church hierarchy as well. Let people stay at home. Our God is everywhere. Even as we are talking here, God is here. He says omnipresent everywhere. So what is there? If we have to wait for a while for this period to go, then we can come back together, safe, healthy, and happy. So I think people should comply. There's no second chance to this thing. If you test positive, please comply with all instructions from the sources of information. World Health Organization, they have instructions everywhere. NCDC, we have instructions everywhere. Even World Health Organization. So people should comply. Isolate yourself if you are positive. Even if we are not positive and you know you have exposed yourself by traveling, self-isolate, because it's like something you can call a chain. If you traveled, you are back, you are positive, you refuse to report, you refuse to isolate, you have exposed the whole of your family. So what are we talking about? It's teaching time, saves nice. Self-isolation is perfect. Quarantine is perfect.
We are taking care of our customers because of the outbreak of coronavirus in the world, and we make sure our customers are sanitizing their hands.
So can you show us?
When they come to this place, the best way they come to this place is not like that. When they put their hands here below the dispensing machine, their hand just like this. It will enter the rubbish in their hand. All my staff, both the production and the service personnel, they are with their hand glove and their nose mask. So even the food we produce here is very safe. Our bread, very safe. So I would encourage anybody that comes in to sanitize his hand first, because that's the first point of contact, the hand. By the time they sanitize their hand, they will no longer spread it. So I encourage them, those who have nose masks, they should put it on. Those who have sanitizer, always use it. Wash your hand regularly. Don't wait until when you eat, you carry something and put in your mouth. You can be infected. It's like sanitizer and hand glove, nose mask. The one thing is that the place we are buying this in is very expensive. You can see because of this issue, many supermarket, pharmacy, they hike the price of these things. Like this machine is 25,000 naira for one. It's not everyone that can get it. The sanitizer itself, 500 ml, 4,000. And these are the things we do. And we get it every day to make sure that customers are safe. Another thing like nose mask, they shouldn't inflate the price. The prices are becoming so high because of this issue. So the government should look into that.
I want to withdraw money from my account. I think they are calling in customers in batches of 10s because of the rule, so as to enable us avoid the spread of coronavirus.
Yeah, what's the precaution you're taking concerning the coronavirus, the COVID-19?
The precaution I'm taking?
Yes.
Before I came, I have sanitized my hands, I have washed my hands, I make sure I practice personal hygiene every moment. Even before now, because I studied health, I have been putting it into practice with my children. If you go out and you come in, before you touch anything in my kitchen, you must wash your hands. Going to toilet, after eating, you must thoroughly wash your hands. So I've been into this practice. The only different thing is that we have now added sanitizer, the hand sanitizer, into it. Then we now make sure that our noses are moist with rub, keep it moist every minute, because we're exposing ourselves to air. We're in an open place and the weather is tense, and you know they said this thing cannot survive under a tense weather, so I don't think it's so harmful for us. we're exposed, there's air, there's cross ventilation. So I don't think there's much harm standing here with other persons. And believing God too, it will never be for us.
I'm in the queue to do some transaction with UBA. This consciousness of the virus that is ravaging the whole world at a very pandemic level, and for that reason they are being very, very cautious, making sure that not more than 20 persons get into the bank for transaction. So the counters intends to enter the bank for our various transactions. And in Delta State, none has reached us, but that does not mean that we should not be cautious. We avoid some body contact with people. We do hand washing. We do some social distancing, avoiding crowds of not more than 20. So that is what we are doing. So we stay in crowd of not more than 20 as preventive measures. So for the face mask, not everybody is comfortable with wearing it, because it draws attention to ourselves when we walk with the mask. I know it is unique and it's not cultural to us to wear such mask. So that is the reason why a lot of us are not even putting it on.
Come for our money, but we have been stranded ever since 10 o'clock. I've been here. It's after 12. They'll take in 10. Then after they are through with the 10, before they are allowing 10 to go again.